Dementia affects each person differently, and it is very important to understand how the brain functions. So if you look at this brain model, it has got different main four lobes in the brain. The frontal part is called the frontal lobe. On the side where our ears are, this is called the temporal lobe. The top part is called parietal lobe, and the back of the brain is called occipital lobe. So there are particular main functions which are associated with these particular lobes, although the brain function is very complex and it is all interconnected. But for simplicities, it is very important to understand what are the main functions of each lobes. So for example, if you look at the frontal lobe, it deals with what we call executive function, in which person is able to make a planning for any event, or they can do judgment. They also deals with their emotions, their social behavior, their mood, their language, the empathy as well. So if this area gets damaged, these behaviors, they become more prominent in way of signs and symptoms. When you look at this area, which is the temporal lobe, the main areas which it deals with are speech, comprehension, language, memory, but also deals with facial recognition and emotions as well. So again, the disease in this area predominantly affect these main functions of the brain. The top part of the brain, which is called the parietal lobe, it deals with what we call the learned behavior, such as driving, reading, writing, calculation, but also deals with what we call as spatial awareness. For example, where is object in this space in relation to your body, and also deals with object recognition. So again, damage to these part of the brain will result in problems with these functions. And the back part of the brain, which we normally call visual cortex or the occipital lobe, that deals with what we call like color recognition. It also deals with hand and eye coordination. For example, if you have to pick an object from the floor, all this area and how your body work and how you can see these objects, this area deals with that. But it also deals with what we call object recognition, color recognition, and also spatial orientation as well. So over the period of time, when the disease, it predominantly starts with one area, and person will experience problems related to function of that particular area. But over the period of time, when the disease spread in other parts of the brain, then the signs and symptoms can vary over the period of time, and people can experience more problems over the period. There are many different symptoms of dementia, and each person experiences different symptoms, and they may vary over the period of time. So the most common symptoms that they experience could be memory. So their short-term memory can be impacted, or their long-term memory can be affected as well. So you may have difficulties, or you may have noted difficulties in your loved ones where they may not be able to remember what happened more recently. Or they may have difficulty where they cannot identify where they have placed their belongings, or they may be misplacing items. Over the period of time, they may have difficulty where they may not be able to remember important dates, anniversaries, appointments, or what happened over the last weekend. So, having understanding about the timeline of events may be very difficult. They may be able to, send birthday cards on time and all, but over the period of time, because of dementia, they may not be able to remember important birthdays, anniversaries, and dates, or diary, calendar, events that were very important to them. Along with this short-term memory, the dementia can also impact the long-term memory as well. Some people may also experience problems with their language. They may have difficulty naming objects or naming their friends or family. They may have difficulties with recognizing familiar faces of their friends, family, or their loved ones. And sometimes what people experience is difficulty with their concentration, with their planning. They may be very good cook, but they may having difficulties on following the steps of cooking, and you can see those difficulties in their day-to-day life. There are also times when people have difficulties in following the timelines of the events, or even not remembering what day of the week it is, or what date is it, or which month they are in. So, difficulties with the timeline that may be more noticeable over the period of time. Sometimes, due to the dementia, you may experience some changes in your mood and behavior. People may feel a little bit more irritable, short-tempered, or have difficulties in dealing with the situation. So this is all due to the disease processes in the brain as well that people experience these changes. Sometimes people also experience what we call hallucinations, where they see things which are not there, or they hear voices when no one is around. And sometimes what you experience is what we call delusions, where they firmly held the belief which is not true, but in their own mind they feel that this is real. These changes are due to all the disease in the brain due to the dementia.
The treatment available for people with dementia can be just in very simplistic terms divided into pharmacological treatments and non-pharmacological treatment. The pharmacological treatments are mainly for people with Alzheimer's disease and those with mixed dementia, that is, those having Alzheimer's and vascular type of dementia. There are 4 drugs which are licensed for treatment of people with Alzheimer's and mixed dementias. They are categorized into 2. One is the cognitive enhancers, which include donepezil, rivastigmine and galantamine, and the second category is called NMDA receptor antagonist, which is memantine. But when we look at the non-pharmacological treatments of people with dementia, they are mainly looking at psychological measures and others. So we look at people who are having sleep problems, for example, or people with agitation or other behavioral conditions. They may benefit from these non-pharmacological measures. That includes psychological therapy as well as aromatherapy and various activities which can enhance their quality of life.